The resurgence of mpox has sparked global concern, particularly with the emergence of a more deadly variant. The new clade 1b strain is primarily affecting the Democratic Republic of Congo, with nearly 17,000 cases and over 570 deaths this year alone. It's also spread to neighboring Burundi, Kenya, Rwanda and Uganda, with cases also confirmed in Sweden and Thailand. Now, while the World Health Organization stresses that mpox is not the next COVID, the current outbreak is posing a serious challenge in the DRC, especially for children. DW's East Africa Bureau Chief Mariel Müller reports.
Nzanambaho, who is 3, and his 12-year-old brother, Sibomana Titu, are recovering from mpox. Their mother is relieved they're on the mend. The virus hit her little one particularly hard, she says.
When the illness started, he didn't sleep. He was crying all night. In the morning, he had a high fever and started to get rashes. That's why I came here, to the hospital.
Here, doctors gave the children antibiotics and a cream and monitor the temperature.
The rashes were hurting me, but when I put the medicine on, I feel better.
This hospital near Goma in the Democratic Republic of Congo is full of children and young people with mpox. They're more likely to get it and more likely to die as a result. The viral infection spreads through contact with skin, saliva or breath, but also through sexual contact.
We have a mortality rate of between 5 and 10% as the disease is transmitted directly and massively. In the context of Goma, we have a displaced population in the camps. Here, the risks are really high.
Living in cramped camps for people displaced by conflict is a health risk in itself. Cholera and polio outbreaks are common, and there's not enough to eat or clean water. Now there's mpox too.
At home, life has become complicated. It's difficult to feed my children. I work at a farm to earn money for food, but now I can't do that because I have to look after them here.
Together with her children, she's now in quarantine here. To try to stop the virus spreading via the children's clothes, she washes them as often as she can. News about the virus sows uncertainty and fear.
In the camp, we all live together. We greet each other a lot with our hands, and they say touching is one of the main factors in the spread of the disease. I'm afraid I might catch the disease and die. We demand more help with medication.
Health organizations say they urgently need more supplies to help those affected, and awareness campaigns to try to stop the virus from spreading.
It's time for politicians to act. We need more vaccinations. Also, the WHO has to step up here.
Zainambaho is recovering from mpox, and his mother, Maombi, hopes to return to her other children soon. But she worries about the new virus. It's another danger stalking families like hers.
I spoke to Dr. Ngashi Ngongo, Chief of Staff for the Africa Centers for Disease Control and Prevention, and I asked him what exactly African countries are doing to control the spread and how they're responding to the surging cases.
Yeah, I think the declaration was really a booster and a catalyzer to the response in all these countries, DRC included. What we've seen that all the countries have either developed or updated the outbreak response plans, which is very positive. Now they know exactly what they need to do. And that's the reason why Africa CDC has really deployed a very strong team and established the continental incident management system here that I'm leading, here established DRC as the epicenter of the outbreak. We've also seen the reactivation of the strategic coordination. Now we have meetings, coordination meeting for all the stakeholders, all the actors that are being coordinated by the minister himself. That is a big change, a really big boost. We had a meeting with the Prime Minister. She really reassures us of the commitment of the government to really fight this mpox. We met the Minister of Finance, who announced that the government itself is putting 6 to 10 million already in the response for mpox, with the first 3 million being disbursed today. That is the kind of wake up that we see, that these governments are really waking up and taking this mpox seriously.
Right, they're waking up, but do they have every tool they need, or do they need the world to support in some way?
Of course, this is where you want to see really the international solidarity coming in. Just to give you an idea, DRC has requested for 3 million doses of vaccines. They don't have vaccines. All the 12 countries, there is no vaccine in Africa right now. And Africa CIS is working very hard, really, with the partner to get that international solidarity come to the rescue of these countries. The 3 million doses of mpox that the DRC is looking for, we have a request from South Africa, 40,000. We have a request from Rwanda, from Cameroon, and from Egypt. All of them are requesting for vaccines. Vaccines are not in Africa. One single dose costed European countries over 200 euros. Now, can you imagine Africa can't afford that kind of cost? Now, they negotiated HERA, the European Union, through the HERA, which is the Health Emergency Management Agency, has negotiated now the buying of these vaccines at about 114 euros a dose. Now, you see, that kind of money, the DRC cannot mobilize it. For the 3 million, that's about 300 million. If $300 million, they can't afford that. That's why the international community of solidarity is most welcome. And we are also seeing good signals already. We need to mention that.
How are you addressing the challenges of distributing these medical supplies and vaccines, if you get them, to the remote regions and the areas affected by conflict in the DRC?
Yes, I think we have already identified, and we have the European Union through the Health Emergency Management Agency that has offered 215,000 doses of mpox vaccine. We have also Gavi working with the US government that have offered 65,000, the total already 280,000 arriving in Africa in the next 2 weeks. Now, the good news is that these countries established already a system for the distribution of vaccine for the COVID-19 pandemic. That is the same system that we are reactivating. They have capacity for storage of vaccines with the cold chain that is really adapted to the low temperatures that are required for the mpox. They have means of transportation to the provinces and to the district and to the health centers, I think, that were established during the COVID that are going to be reactivated. We have health workers at all levels that were already trained, I think, for the delivery of the COVID vaccines. What we are going to do with them is just to reactivate the same system and retrain all the health workers now on the mpox vaccine, and then that system should work with not much really difficulties.
Okay, and just noticing children seem to be the hardest hit by mpox. Why is that? And are you doing anything specific to protect them?
Yes, I think that is one of the great concerns. Right now, if you look at the DRC, up to 60% of people that are affected are children. And we also understand how they get infected. I think we have, on one side, the intensity of the contacts on one side, but at the same time, it is also the immunogenicity of children as they are growing. Their immune system is still building up, but also added to the fact that, as you might know, is that in DRC, up to 40% of the children are chronically malnourished. Now, you understand the context in which this is happening. Now, we are working with UNICEF and the organizations that are specialized in working with children to design the communication messages that are really adapted to educating the communities and the parents and the caregivers how they can protect these children with the basics of hygiene, the basics of avoiding contact with people that are infected, the basics of avoiding contact with animals that are sick. That's in one area. And right now, we are also very much concerned that the schools will be opening very soon, and also planning with the ministries of education and all the partners how we can enter the schools and educate those children, first of all, for themselves and how they can protect themselves, help the schools to set up systems for the basic hygiene of children, hand wash, and all drivers of change in their own families where they can educate their families and communities.
Okay. Dr. Ngashi Ngongo from the Africa CDC, thank you for speaking to us.
It is my pleasure. Thanks for having me.